topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. As you heard, we do all different types of shows across the country, legal, health, financial, and home improvement. But this show is a show that's so dear to my heart because unlike some of you who won't admit you have a snoring problem, I did admit it, and I went and had a sleep test and found out I had sleep apnea. And I got to tell you, my life changed so much, and that's why this show is so important that we are doing today. We found one of the top ear, nose, and throat doctors and sleep apnea doctors in the Houston area. Let me welcome Dr. James Ludwig. Hey, James. Is James there?
Yes, sorry.
Can you hear me okay?
Yeah.
Okay. So I was just telling people how special this show is because I have sleep apnea. I guess you still have it even if you use a CPAP machine. It never goes away, does it?
It can if you make a body change.
Oh, okay. Well, I'm working on that too. I'm not afraid to admit, hey, I've told people that I'm on Ozempic. I've told people that I had a snoring problem. Hey, I'm a guy. It doesn't matter to me. I'm doing something about it. James, tell people about your practice because you don't just do sleep apnea.
Right. I do a lot of sleep and sinus treatment. They kind of go together. Nasal congestion, obstruction, sleep quality. Outside of having sleep apnea, people don't sleep well if they can't breathe well through their nose and they're congested, right? So breathing well through your nose definitely affects, or not being able to breathe well through your nose affects your sleep quality. And then patients that have sleep apnea, having a good nose helps you treat it. It doesn't really matter the treatment that you end up doing. If your nose doesn't work well, the treatments, whatever they are, aren't going to work well. Like if you're trying to use your CPAP machine and you're all congested, that's not going to help you use your CPAP machine. If you have a sleep surgery and you can't breathe through your nose, you're not going to be able to breathe well at night to, not have sleep apnea. So they're actually very intimately related. So that's pretty much, I do some general ENT for sure. I was trained to do general ENT, but I do a lot of sleep and sinus care.
James, I got to admit, the reason that I finally did something twofold, I found myself falling asleep at the wheel. I'd be at a red light and I'd fall asleep, or I would talk to somebody and I'd fall asleep.
Yeah.
And even worse, I would just be sitting there with friends and doze off and start snoring. And I knew then it was time to do something about it.
No. How long do you think you had sleep apnea before you?
I probably had it for 3 or 4 years before I did something. But I don't know why people are so embarrassed that snore. And I know it's not, I've learned from you, it's not just sleep apnea, but it's a health issue. And hopefully with this show here that you will go in. I waited way too long. I wish I would have gone in sooner because even with the CPAP machine, I'd much rather be using that machine than what I went through before. Because I could have, every time I see an accident, James, I think, I wonder if they fell asleep at the wheel.
I didn't know this. I just diagnosed my friend. He's my age, and he's like 165 pounds, and he works out all the time. I mean, he's a very, very fit guy. And he's been dealing, and he unfortunately has lupus. And he takes chronic prednisone, like 1 or 2 milligrams. It's not much, but when you take it every day, he ended up having a stroke a few years ago. He's paralyzed on his left side, and now he can walk, but he has a shoulder droop, and he has a foot drop kind of stuff going on. But I bring it up because he's complained of feeling tired for a long time, and so like a lot of guys. Because no offense, I mean, you look like someone that might have sleep apnea. You're a big guy, so people think that people that are only people that are big have sleep apnea, But so of course he went and got, first it had to be testosterone. So you go see the wellness guy, and now he's taking the pellets or whatever for testosterone, and he thought that was a problem. And then he thought it was his lupus was a problem, so he tried taking more steroids. And people think it's their thyroid, so then they get that checked. And I mean, honestly, the last thing they check is their sleep quality, And he does have sleep apnea, and he was taking stimulants to try to help, be more, have more energy during the day, taking Adderall, things like that. So a lot of people search a lot of other places than just the most basic thing that we all need, which is good sleep to feel better. And it's interesting to me because people will take a lot of drugs. I mean, I look at patients that come in, they're on their Lipitor and their labetalol and their whatever other non-essential medication. And what I mean by that is when they take, I'm not talking about diabetes medications, but when you take cholesterol medicine or blood pressure medicine, for the vast majority of people who take those, you don't feel better because you took your blood pressure medicine that day. You don't feel better because you took a cholesterol pill that day. You take them because you're afraid that if you don't take them and you don't control those things, you're going to have a premature heart attack or stroke.
Yes.
And untreated sleep apnea causes premature heart attack and strokes, but it's a lot easier to take a pill. And I'm just getting back to your point of why people don't get evaluated. And it's probably because of the thing that you wear that people don't get evaluated, because they think that maybe the only thing that they can do is air pressure, or they don't want the treatment, so they don't want the answer. So I understand why people don't get diagnosed, but there are a lot of things you can do outside of air pressure for a lot of people, not everybody, but for a lot of people. So, it's sleep is not an optional thing we do, and living with undiagnosed sleep apnea year after year after year. And you said 3 years, but I bet you it was 10 years. It's just 3 years that you didn't feel good. But what about the years you had it where you thought it was other things, or you weren't quite that bad, that you just tolerated it because you felt that was your,
I tolerated it, but I got to tell you, it was so embarrassing. I was in a class, and this is what really did me in, and I fell asleep, and the teacher said, "Stephen, you're sleeping and you're snoring." And I said, "That's it," because I didn't know I fell asleep.
Yeah, that's
so embarrassing
when you're really bad. And then, but that's also kind of the problem too, is you don't have to be as bad as you are to have bad sleep apnea. So you don't have to be passing out while you're driving and all that. You could still have very significant sleep apnea, so it's a masquerader for sure. Everyone perceives their disease a little differently, and the other thing I was gonna tell you about my friend that, I find out through talking to patients, like, he doesn't even sleep in the same bedroom as his wife. I didn't even know that.
Yes.
And that's actually, as I ask more patients, that's a lot more common and nobody will talk about it. It's like, I guess it's nobody's business, really it's nobody's business, but these are all like the subtle impacts it has on your life. Like you're not sleeping with your wife anymore. She can't sleep because you're in the bed. I mean, there's people, what are the impacts of untreated sleep apnea? I mean, there are a lot of collateral damage that goes along with untreated sleep apnea. And then people think the machines are loud when they're not.
No, they're not.
They're certainly not louder than a bear in your bed snoring away.
Yeah.
And then like today, I saw this couple, and actually the guy is a small guy. The wife is the one that likely has it. And I was like, "Is your sleep restless? Do you move around a lot in the bed?" And then the husband starts laughing because I guess she's all over the place, And then so he can't sleep because she's all over the place. So sometimes it's like hearing loss. People that have hearing loss, it affects everybody but the person who has hearing loss. The person who has the hearing loss doesn't really care they have hearing loss, but everyone around them, it drives them nuts, because they have to repeat themselves and all that. And sometimes sleep apnea too, it's bothering everyone around you, even if it's not bothering you as much as you think it is, So
James, I had little kids who would make fun of me. Gosh, Dad, you snore so loud. I mean, they're in the other room and they're going, that was embarrassing too.
Yeah. Yeah. No, I got you. You got to feel good. I mean, that's the thing, and people that treat it like you who feel good, I mean, they really don't care anymore. They just care that they feel good. And unfortunately, it's hard. It's hard to know what that's like unless you do it. It's hard to know what it's like to be treated unless you give it a chance.
Well, James, how does somebody? Because we just had a gentleman, and I think it's Friendswood, who had a question. And he said he's going to be in his car listening to the show. How does one know? Like, I didn't know I had sleep apnea. I mean, how does one know that they might have a problem?
I mean, it's basically anything that you could associate with not sleeping well or sleep deprivation is a symptom of sleep apnea. So if you just imagine when you meet someone, you go meet your friend and, they're like to just get up on the wrong side of the bed because they're irritable or they're moody, they're edgy, they're obviously tired. They have a hard time staying awake, like you said. They feel their sleep is restless. You wake up with a dry mouth. Dry mouth is very common because when you have your obstructions and you break the obstruction, you breathe through your mouth. It has nothing to do with nasal obstruction. It has to do with the fact that you're breaking an airway obstruction. And so you mouth breathe, and that makes you feel, that gives you a dry mouth. So those are the questions. I mean, really 5 or 6 questions. I can ask a patient 5 or 6 questions, and I pretty much know whether or not they have it. If you have high blood pressure, if you've had a stroke or heart attack, high risk, for having sleep apnea. If you're overweight, if your neck is over 18 inches, if you're a man, 17, if you're a woman, you have a higher risk. If your BMI is over, 32, 33, you're higher risk. So there's risk, but there's just, and I'll tell you one cool thing you can do, people that have an iPhone, they don't have it on Android, but if you go on your iPhone, I don't know if you can see this or not, but there's I don't know if you can see my phone here, but you see that time lapse option?
Yes.
So what I tell patients to do is turn their camera on, put it on their nightstand, put on a nightlight at night, and videotape themselves in the bed one night. And it's funny though, they're like giggling when I'm telling them to do this, like it's like some kind of, like people like, watch myself sleep. That seems so weird, like so odd. But you can, if you're all over the bed, if you're really restless, or you see your legs moving like this, or your arms, you're twitching a lot at night, that's very common with patients who have untreated sleep apnea. And when I used to own a laboratory, a real lab where you come in for your sleep testing. I think what you went through, and
yes,
we do videotape the patients. We have infrared cameras, and what I would always do when patients came in for their results is the last thing I would do is show them all the reports and numbers and all that. I would pull up their video of them sleeping the first night, which is the night where they're just, their natural breathing. And I would fast forward. I would do time-lapse photography, the same thing this phone's going to do for you for free. And then if they were positive, we would have them come back again for the air pressure therapy or the CPAP, treatment. And then we would also videotape them that night. And then I would just play both videos back to back. In the first video, they're like a jumping bean. And then the next video, they're like dead. They're not even moving in the bed. They can't even believe the difference. And when patients would see themselves moving and then not moving, i.e. being restless and then not moving at all, they can really understand how that pathology is affecting their quality of sleep because they actually see it in real time. So one thing you do for yourself is try, even, if you have a CPAP, one night you sleep without it with the video recording, one night you sleep with the video recording, you'll see a huge difference in your restlessness. It's pretty cool. So this used to be done in labs and stuff, and now you can do it at home with your own phone.
Well, if you'll look over to, we have got a lot of questions coming in. Let's go to Tom. Why do those machines need water, and what is the water effect on the body when using the machines?
Well, the water is just for comfort. It's just to when you're using air pressure, you're moving. There's a leak, first of all, built into the system, so you're moving more air. And if you move more air, that means you're going to dry out things more, which means you may find it drying on your airway. So it's a comfort. I have patients who don't use it at all. They don't need it. They don't care.
I don't use mine.
Yeah, but in the beginning, maybe you did. And so in the beginning or even long term, it's just a comfort feature. It's not a therapeutic feature. It's not required for therapy. It has no effect on your body per se. It has effect on your tolerance, perhaps.
I'm so glad you said that because it's not spring water. I forgot the kind of water it says you're supposed to use.
Well, you want to use distilled water, but the same reason that
distilled. That's right.
I remember as a kid, we used to, before microwaves and stuff, we had the tea. You heat the water up in the teapot or whatever, and then there'd be all that lime on the bottom, right? That white crap because water has stuff in it, and as you boil the water away, the stuff doesn't boil away. So
right.
Your humidifier is basically a pot of water on a stove because that's how they heat it with heat. It's just it's like putting a pot on the stove full of water and then warming it up, and then the water evaporates. So if you keep adding water every day and that water has a bunch of junk in it, the junk stays behind. So that really the reason you use distilled water is not for your health. The reason you use distilled water is really for the longevity of the chamber that the water sits in.
Interesting. Okay.
Yeah. Because once the water evaporates, it's pure water, right?
Yeah.
Yeah.
We go to Oscar. What does snoring actually affect the body?
Well, I mean, snoring is a noise. It's a sign, right? Snoring is a sign of airway resistance when you're sleeping. I mean, I bet if you don't wear your CPAP machine, you snore like crazy. I bet.
Right. Yes.
Okay. But you're not snoring right now.
No.
Right. So that means there's something different about your airway when you're sleeping than when you're awake, or you'd be snoring while I'm trying to talk right now.
Is it because you're on your back?
No, because if you're awake and laid down, would you snore? Right now, if I laid you down, would you snore if you're wide awake?
Probably not. No,
right.
I would.
So it's the relaxation. So snoring is a sign of airway resistance. Like smoke's a sign of fire. Do you actually have a flame? So when someone snores, it's just your body telling you you're developing a lot of upper airway resistance. But it doesn't necessarily in of itself mean that you're snoring or you have sleep apnea. It's just a sign of resistance. And then some people who snore also get into periods of time where they don't get enough air. That's the difference between snoring and sleep apnea event. Snoring is you're making noise, but you still get enough air. And sleep apnea is when you have so much airway resistance, you actually don't get enough air. And then there are some people, believe it or not, they snore so loud, they actually can wake them. They can create arousals through just the loudness of their own snoring.
Yes.
But technically that's not sleep apnea. That falls under a term we call sleep disorder breathing. It's a sleep disorder due to breathing, but it's not sleep apnea, So it's like another version.
Here's Missy. My grandfather snored for years. He was fit and lived to nearly 95 and slept so well he was hard to wake up. What does snoring actually do to the body? That's another, what does snoring do?
This is similar. Yeah.
Let's go down to Sandy. My dad lived over 89. All these people now have family members that lived a long time. Yeah. And he snored and smoked.
Yeah.
Other than bother.
My dad lived at 90 when he smoked. I guess it's okay to smoke. I mean, that's like, to me, that's the same illogical, I guess. question.
Others then bother others trying to sleep around him. What did snoring actually bother?
Yeah.
I got to tell you, when I heard myself snore, James, God,
Well,
I
I'll
was
tell
like,
you that when I examine somebody, I already know if they snore. I don't need to ask them. I just look at their palate. And when someone snores,
so you don't have to even look at a sleep test. You already
well,
know.
I know if they snore by their exam. I'll ask them if they snore to see if they know if they snore, but I already know the answer before I ask the question. Yeah. I mean, think
Look,
about it. Your palate's like this big, okay?
yes.
So if you're snoring 10 out of 10, which means they can hear you down the hall, next room, whatever, how hard are you pulling to make that poor little thing vibrate that
Oh,
violently
that's right.
that you can hear it all over the house? I mean, like think of just common sense that out, right? If you're vibrating your throat that severely, something probably more than just a noise is going on. I mean, just common sense, right?
Yeah.
Yeah.
Here, Gloria, what if you had a sleep study and it says you stop breathing 58 times an hour?
Then you
What
should get
can be
treatment
done
right
in
away.
that case?
Then you should get treatment right away.
Yeah.
Yeah, it means in a 7 hour night, you're having, 400 airway occlusions, which means you're having 400 interruptions of your sleep, which means your sleep is being broken into 400 fragments. I mean, how good can you feel if your sleep period is being broken into 400 fragments, right?
I'm wondering if she had a sleep study done and they told her 58 times, how come she's not being treated for it?
Yeah. I mean, it's the same thing. You just have to go through. I was talking to a patient today actually about, well, I wasn't. I was talking to a rep today who sells the CPAP equipment, works for Philips.
Oh, okay.
Yeah. And I was telling her that I've learned in my 20 years that for a lot of people, sleep apnea treatment is a journey. It's not, it's not necessarily just a one and done. So it's kind of like vision loss, right? You start with glasses, and then you go to contacts, and then you go to LASIK, and then you go back to glasses. Like that's my story. You have it, and even in different parts of your life or different times of your life, you have things that are more or less important to you. So maybe you have sleep apnea when you're 35, and you're like, I'm not wearing a damn machine, and I'm not doing this and that. But maybe when you're 55, what you cared about at 35, you don't care about as much when you're 55. And now what you wouldn't do at you're 35, now you're willing to do when you're 55. A lot of people have come in, they were diagnosed 10 or 15 years ago, and so they can't use a CPAP machine. And the sad thing is they get no treatment, which is a whole other topic. That's not acceptable. But because there are other treatments you can do to do something rather than do nothing. But now when they come in 10, 15 years later and, they weigh 30 more pounds than they weighed when they were, younger. Usually people gain weight when they get older, not lose weight. Um, and they still have significant sleep apnea. Now they're not only willing to use CPAP, they actually become good at it. So a lot of it has to do, any treatment you have to self-administer, you have to find the value of that treatment and you have to want to do it. I don't care what it is. I don't care if it's a diet, exercise, diabetes. All of these treatments require self-administration of treatment, And if you don't believe that you need to work out, then you're not going to work out. Doctor tells you need to eat better and you don't want to believe you need to eat better, you're not going to eat better. It doesn't matter what they tell you, right?
James, do you ever have patients tell you, because this is what I've gone through, that they cannot sleep without the CPAP machine? They're
Yeah.
so used to it. I mean, I went in the hospital and they let you use their machine, which was antiquated. I could not believe it was, it was loud. I
Because
couldn't sleep with theirs.
yeah, but I'll tell you why that is. It's because when you develop sleep apnea, you develop it very slowly. You don't wake up one day and have this lady that has 58 an hour. She didn't go to bed yesterday with 0 per hour. And then a day later, she develops severe sleep apnea and gets a sleep study saying she has 50. Because if that was the case, everyone would be coming into the doctor, immediately. Pardon me, because you would know if your sleep was that different from one night. The problem is, it's not like that. You start off with 1 an hour, then 2 an hour, then 4 an hour, then 8 an hour, then a 10 an hour. Then, do you understand? And it happens very slowly over many years. So you learn to, like, that's your baseline, that's your normal. until you get so grotesquely abnormal that you realize that you're like something's wrong. I mean, I have guys come in, they look tired, like literally their face, they look like they sleep
Right.
like shit, So, and amazing when they want to know the best skincare product for your face is treating your sleep apnea, because when they treat their sleep apnea, they look 10 years younger. I swear to God, they look so much better. So that's why people can't tell. That's why when you don't use it, you feel like you have to use it, because it's an immediate change. You're going from having whatever you have per
Yes.
hour to zero with the machine, and then without the machine, you're back to whatever you are, like that. That's why you can't sleep without it. Does that make sense?
Yeah. I mean,
Yeah.
I hear people say, "Oh, sometimes I use it, sometimes I don't." I cannot believe that. Um, I think we've already kind of talked about the stigmatism about snoring.
Yeah.
Um,
I mean, no
Clancy,
one gives a shit if they snore
go
if
ahead.
they're in their bed by themselves. I mean, who gives a You sleep in your own room, in your own apartment, nobody gives a
Yeah,
shit, right? It's
yeah,
when you are around other people, that's why. And what the stigma is, it bothers other people. I mean, I don't think anyone cares if someone snores if it didn't wake them up and bother them, you know? I
but
mean,
people fall asleep at the movie and start snoring.
right. And why do people
That's
care? Because they're
embarrassing.
gonna watch a movie, right? I mean, I don't know if stigma is the right word. I mean, I think it's just,
Yeah,
if you live alone and you're never with a significant other and it doesn't bother anyone ever, I don't think there's a stigma, you know?
but you got to get it treated, though. I'm telling Clancy, and you've actually done diagrams on this before. She wanted Clancy wants to know, does mouth breathing hurt or cause damage?
Well, it does when you're a kid, right? There's
Yeah.
actually a term called adenoid facies in children because their face develops abnormally from chronic mouth breathing. So when you're an adult, it's just not good for your teeth and stuff like that, right? But because your mouth gets dry, then the bacteria in your mouth changes and you get cavities and all that. But certainly for any child that has sleep apnea or chronic mouth breathing, it definitely can affect their facial development.
Harley wants to know, can you have sleep apnea and not snore?
Sure. Because again, it's just a sign. It's not the sign. It's just, if you hypoventilate, I mean, if you hypoventilate and it doesn't cause a vibration, but you're not getting enough air, that's still sleep apnea. You can also have central sleep apnea. Central sleep apnea is different than obstructive. Central is when, and this is usually like mostly related to like heart failure patients or patients with strokes or things, but they're not breathing because their brain tells them not to breathe, which is different than obstructive sleep apnea, which is you're trying to breathe, but you can't move the air. That's why it's called obstructive sleep apnea. We say sleep apnea for short because the vast majority of people have the obstructive variant, but there's definitely other types of sleep apnea, such as central and complex and stuff like that we're not going to get into. The vast majority of people have good old-fashioned obstructive sleep apnea.
I started laughing on this one. This is
Yeah.
from Brent.
I
If
read
you
that.
know you're recording yourself, would you be acting for the camera or would you forget when you fall asleep?
Yeah, well, it doesn't matter if you remember when you fall asleep. All that matters is that you sleep, right? Because you'll
Yes.
leave it on all night long. So yeah, I don't know what kind of stuff you're doing, Brent, but it's just mostly for sleeping, buddy. Yeah, you want to do some acting for the camera? That's between you and whoever you send that to.
I got to tell you, there's got to be a reason. Your show gets more questions on the chat line than any other show we do. I don't know if there's a lot of people who are deniers out there, but
Mm.
I got to tell you, you got to get in. You people in Houston, you've got one of the finest ENT doctors, sleep doctors, I think, in the whole state. And it's not, you don't just do CPAP machines. You have a lot of different ways you can treat your patients.
Yeah, we do. We dispense oral appliances. I do sleep surgeries. We do sleep endoscopy. We just talk about CPAP because everyone knows what that is, I think, pretty much. But it's not the only option. The problem is when you talk about other options, you have to be willing to accept what the other options. Look at every treatment's got, its deficiencies. You learn to accept the deficiency of your treatment. It's you don't even think of it as
Yes.
a deficiency, right? But you don't mind being hooked up to a machine. That you got to get over that. You don't care what it looks like, and you don't care what that you have to use it. So there is no perfect treatment. Okay, every treatment is going to have something you got to accept and something you got to, a risk or reward kind of thing. And the benefit of me, the benefit of me is that I've done all the treatments for 20 years. I've had a lab for 10 years. I do home sleep testing. I know how they all work together. I do them all. I don't just know about them. I do them. So the problem is when you go to like a pulmonologist, he knows that there are other treatments, but they don't have any firsthand knowledge of actually implementing those other treatments. They just know they exist, but they don't manage it. So they don't really know. It's like I'm a football player, but I know about baseball. It doesn't mean I know how to play baseball, So, and dentists usually dispense oral appliances, and they know about CPAP. They don't know how to manage one. And they know about surgeries. They have no idea what it really involves, what the recovery is like, or when to do them. They just know about them. Really, you'd be surprised. I think patients give doctors too much credit for how much they know or don't know. We don't know everything. We really don't. We know what we do, and hopefully, what we do we know really well. But you have an idea of stuff. But I'm not a cardiologist. I'm not going to tell you about all the stuff about stents and heart failure. I know about it. I don't know enough to, give you good advice on it. So that's why I think people drop the ball is they assume that their primary care doctor knows all about the different treatments of sleep. They don't know. Trust me, they have no idea. They don't even know about the nose. They don't know about turbinates and congestion. They know that they exist, but they don't do any of the procedures. They don't manage it. They don't. Do you see what I'm saying? So you
I
rely
had
on.
the same problem. My primary care, he had no idea what I was talking about.
Yeah, and then even they know about sleep apnea, but what do they do about it? They order a
Yes.
test and they order a machine, and then if you do have a problem, they're like, well, what did the guy who gave it to you say? Did he think? Well, the guy who gave me the machine thinks that I should try this. Okay, well, here's a prescription. Try that. Oh, the
Yeah.
guy that gave it to me said I should raise the pressure. Okay, well, we'll raise the pressure. They don't actually manage. It's not their fault. They don't learn it. It's not that they're stupid or anything. They just don't. I mean, they're too busy with your diabetes and the blood pressure and the cold and the they have to know a little bit about everything. They don't know a lot about anything. That's that's medicine when you're a primary care, and you really need someone who has experience with the different treatments to know how. Sometimes we don't just use one treatment; we use two or three. We put them together, to get a good outcome. It's not just a one and done. So that's kind of the issue is the people are going to see people who have a pretty unidimensional understanding of how to treat sleep apnea. And that's exactly why I see people all the time who were diagnosed and who are untreated because they weren't given any help past the here's your prescription for your CPAP machine. They weren't even helped on how to use their CPAP machine.
Here's kind of a cool question. We just got in. This is from Corey in U City.
Mhm.
He said, what would you do if you're active meeting women and you're afraid that if you meet someone and spend the night with them, that you're going to start snoring? Can you fix a snoring problem?
Well, does that person know they have sleep apnea or not? I mean, maybe,
They want
maybe yeah, I mean,
to. He's embarrassed that he snores.
right. But that's why you need an airway evaluation to find out maybe you snore just because you have nasal congestion, which is really, I mean, we have really good procedures for that or really good treatments for that, whether it's medicine or surgery that don't hurt that much and that work basically every single time. They're not, like it might work or could work. Or maybe you need a night guard or, maybe an oral appliance and that would solve your problem. I mean, it's like I said, that's why you can't just put everyone in one bucket.
Right.
I had a lady that she had 15 obstructions an hour and she had nasal obstruction and we did nasal surgery and she went down to, 10 or 5 per hour. She went from 15 to 5 with a nasal surgery. She wasn't overweight. because if your mouth is closed and your nose is all congested, you're going to pull hard to get the air you need. You're going to create a lot of negative pressure trying to pull that air through your crappy nose, and that's going to promote your throat to collapse. So, I mean, it's a dynamic airway. It's a dynamic, they all play off each other, you know. So he needs to go see a good ENT who knows sleep and find out, you know, what his airway is, and then work on those issues that are discovered.
Dr. Ludwig, I don't know if you'll admit this or not. Do you laugh when you see these concoctions online that say it'll get you to stop snoring?
Yeah, I mean,
you just shake your head.
Like Fox News or something. I mean, yeah. I think that's like any problem like back pain or, you know, where there aren't really good options out there. So it's kind of opens the door to people who are looking for the shortcut solution to a complicated problem. And I don't know if people want to believe that snoring is really not a simple problem. It's not always easy to figure out or to correct snoring. And the proof is in the pudding. Historically, I mean, there's literally been, I mean, there was laser of the palate, there was burning cautery, there's BALP and LAUP, LAUP, BAUP, which is basically Bovie assisted or laser assisted uvuoplasty. You know, you burn the palate in the office, and those things hurt. If you want to talk about uncomfortable, recover from that. And then you would do it not once, you'd have to have it done, you know, 4 or 5 times. And the theory was that you would just burn the hell out of the palate so many times it would get stiff from all the scar tissue that you wouldn't vibrate your palate. There's pillar implants that were invented to try to make the palate, you know, and it's cash. These things are $2,000-$4,000 procedures to try to shortcut around the problem, which is the problem is your airway isn't patent or open enough. And that's the root cause. The root cause of snoring and sleep apnea is your airway is not open enough, or you somewhere else, like in your nose, have developed resistance to flow. And so the solution is to fix the resistance. And that's the solution. Whether you fix it or how you fix it, that's the question. That's the $1 million question, right?
Kelly just moved to Houston. She said, I know this is a little off topic, but Dr. Ludwig, do you deal with acid reflux?
Yeah, most ENTs treat acid reflux because when you have acid reflux, a lot of times it comes up here, and then they get throat symptoms like lump in the throat, hoarseness, sinus infections, ear problems. I mean, anytime your reflux gets all the way up to your throat, it's going to cause problems because this part of your body is not designed to have acid all around it. And it is related. People that suffer from sleep apnea and it's not treated, they get a lot of reflux at night from untreated sleep apnea because when you're obstructing, you're pulling really hard to try to get the air that you need while you're obstructing, which creates a lot of negative pressure in your chest. And that vacuum that you're creating in your chest and like just pulls the stomach contents up into your chest. So patients who have untreated sleep apnea usually have very symptomatic or hard to control nocturnal reflux, which is another question that I always screen for on all my patients.
She had a follow-up. She wants to know, is it really true if you don't treat acid reflux, you can get esophageal cancer?
Esophageal cancer? Yeah. It's true.
That is true?
Mm-hmm.
Okay.
Yeah.
Benny wants to know, what is the difference between sleep apnea and other breathing disorders?
Yeah, I don't know what that means. Other breathing. I mean, sleep apnea happens when you're asleep. I don't know what the question means. I'm sorry.
Kevin, and we started kind of talking about this, want to know what other options are out there, I guess, besides the CPAP machine.
Yeah. So there's oral appliances. So I divide it into surgery and non-surgery. So it's surgical option. Non-surgical options are going to be air pressure and then a custom fabricated oral appliance, which is, you know, like a night guard that you wear an upper and lower jaw to hold the jaw forward when you're, or maybe not hold it forward, just keep it from falling back. And good candidates for that, by the way, you know, if you have a small chin or a retrognathic chin, like your back here, a lot of guys grow goatees and stuff that have that deficiency. If you look on the side of your face, you just look deficient, in your jaw, your mandible. A lot of times they do really well with oral appliances because actually the oral appliance, that's what I mean by knowing why you're having, the airway problem. Your mandible goes from your ear. I mean, it's the whole lower third of your face is one bone, this huge mandible. And all of your throat tissues and your tongue, it all attaches to your mandible. So if you bring the mandible forward, all of those things usually follow, including your voice box. So there are all these things that are attached when you hold the jaw forward follow. And then one of the things I do when I evaluate patients for sleep apnea is we do a camera exam in the office of their airway, and I'll have them move their jaw forward and we can look together, and you see for a lot of people, they get a big improvement in their airway. And so a lot of people, I have some very good success stories. I'm talking people have AHIs of 20, 30, 40 who with just an oral appliance get down to 5 or 6 or 7 an hour, which is a phenomenal improvement for wearing a piece of plastic in your mouth that you can put in your pocket, take on the date or whatever the guy was talking about, and then sleep at their house. Or if you're on an airplane, you can pull out of your pocket and put it in your mouth, with really no risk. And that's the thing, non-surgical treatments are non-risky treatments. And then surgical treatments have risk. They have inherent risk, and they don't have a guarantee of outcome. Nobody can do a sleep surgery on somebody and be like, well, when you're done, I guarantee you'll have this amount of.
Well, what is the success rate
Of sleep surgery?
Huh?
It's hard to say. I mean,
Everybody's different.
yeah, and that's the thing. You can read the papers, but in all the literature, but the reality is that most people that undergo sleep surgery get better. That's a true statement. The vast majority will get better. It's just, what do you mean by better? Do you mean I'm 50% better, I'm 80% better, I'm 90% better, So that's the problem with surgery, is that you have to go through the surgery to find out the outcome. And it's not like, when you get a CPAP machine, or like the oral appliance is adjustable, for example, they're both adjustable treatments. So if you're not where you want to be, you can just make an adjustment to it. Like we can raise the pressure a little bit, and you can clear up whatever little residual. But when you're operating on somebody, it's not like you're like, oh, if I just put one more stitch here, they'll be cured. It doesn't work that way. When you do sleep surgery, you identify the areas that are the problem, and then you look at what tools you have, i.e. what operations are available to address those areas. And then we try to give you as much space as we can without giving you a complication. Like, for example, not being able to swallow properly or whatever. So that's the issue with surgery, is there are a lot of people who are healthy, who are really good candidates for surgery, but maybe their risk tolerance isn't there. And then for a guy like you, probably surgery is a very low chance. If you have a 20-inch neck and your BMI is 45 or 50, I mean, most of the literature for sleep surgery is a BMI of under 32, 33. So if you weigh 300 pounds, it's unlikely, it's not a zero chance, but it's unlikely that at least a soft tissue operation is going to make a big change for you that makes it worth going through the risk of the surgery. You know what I mean?
Yes. Listen, I'm on what's called a BiPAP machine. Mine's not even a CPAP, but I got to tell you, every morning I feel so rested. I don't fall asleep anymore. I want to try to get some more of these questions in. Nan wants to know if you've had TMJ a few times, could that be an issue in snoring? And would that terminate to if you have to use a mouth appliance?
Well, TMJ is a broad term, but if you're bruxing or grinding at night, which can put a lot of stress on your jaw joint, a lot of patients with untreated sleep apnea brux. I mean, I can see when they open their mouth, their teeth are all flat. You can see it on the exam. So they're bruxing, and then the question is, are they bruxing because they brux, or are they bruxing because they're stressed out, or are they bruxing because they have untreated sleep apnea? Because remember, every time you have an obstruction, the way you fix it is you have to come out of sleep. You create arousal. And I don't mean come out of sleep, to consciousness. I mean, you have arousal. And that arousal increases the muscle tone of your body. All the muscles in your body, the muscle tone goes up. So that means your muscles of mastication, the tone goes up, makes you clench or grind. And if you're having 15 or 20 obstructions per hour in a 7-hour night, that's 140 times a night that you're bruxing or obstructing. So untreated sleep apnea exacerbates TMJ disorder and is bad for your teeth. And an oral appliance does not exacerbate TMJ because oral appliance actually takes, when you move your jaw open and down and out, you pull your manubrium away from the socket. So you're actually decreasing the stress on your jaw joint, not increasing the stress on your jaw joint.
We've got about 4 minutes left. I really want that this show that people will come to you and not just sit around and do nothing about it, because I did that and I know the difference. And I got to tell you, I guess the big thing is, James, is what if a person just never treats it at all?
Yeah, I mean,
they just let it go.
Right. On the short term, you're never going to feel the way you could feel on a day-to-day basis, which I think honestly is the biggest reason why you'd want to do it.
Yes.
You want to feel good. You're only on this planet for a certain amount of time, and going through life feeling like shit is just not a way to live your life. It's interesting because people who normally sleep well, who have a bad night's rest, I mean, they know it right away. They know it, and the people around you know it. It's like you really can't hide. I mean, I remember residents, and we would have these shifts, literally. I mean, it's just like you see on TV. I'd be at Ben Taub, or I did the ER for 2 months, and we did 24 on, 24 off, which meant we're in the ER for and Ben Taub gets busy at 2. It doesn't slow down at 2.
Yes.
And it turned out to be, it was more like 26 on and 22 off, because you always had to spend more time to get stuff done before you could leave. And you're just so exhausted and you feel like shit all the time. I thought it'd be great initially. It's like, oh, I got a whole day off every other day. It's like, no, that's not it. And so people who sleep normally, who have a bad night, man, they know it. They know it right away. And what people need to understand that have untreated sleep apnea is that's how you are every day, that bad day, but it's every day. And you're just found ways to cope with it that you don't even appreciate, honestly. So the long term, it's like the guy who smokes a cigarette, it's like, yeah, okay. Yeah, I know. I need to stop, doc. I'm going to get, COPD. I'm going to get cancer or whatever. And then they get the COPD and they get the cancer. And then like, God, I wish I would have not smoked. And then they stop after they get cancer, which is at that point, just keep smoking, So the problem with untreated sleep apnea is over time, it really does hurt you, hurt your heart, hurt your brain. And people who have severe sleep apnea, when I mean severe, like this person who chimed in with 50 an hour, they get right heart failure. Your right side of your heart is going to fail over time. You're going to get leg swelling and liver swelling and all this stuff. It's bad news. And once you have that, you're screwed. You can't go back. You can't turn the clock back. So I just, it hurts you day in, day out, and it hurts you on the long run.
We're going to be replaying the show again next Wednesday at 4:00 Central Time. For those, James, who are listening on radio or iHeart or Spotify, how do they reach your office?
You can email us. Well, go to our website. It's sugarlandent.com. That's the best way. And a lot of the things we talk about are on there. And it's sugarlandent.com. Of course, we always welcome a phone call, 281-556-1102. We have real people answer the phone. So hopefully I hear from you.
James, thank you so much. You'll be back again with us next month. Again, we'll be replaying the show next week at this time for those of you who missed it. Thanks, James.
Appreciate you, Steve. Have a good day.
We're so lucky to have Dr. Ludwig. Hey, that's it for us today. Hey, thanks for everybody who wrote in their questions today. I know we got them all in today. That's it for us today. We'll see you next week. Thanks, Rebel. Great job.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.